I remember one lady stepping on a nail in her cow barn with just a bare foot and a rubber galosh on, and the nail went right through the rubber galosh into her foot. And many times the Amish would come to me when they had tried everything they could do. And so you knew that was going to be serious if they called for you to come. And then they would say, well, see what Mary Ann can do. And I would say, no, you're not going to see what Mary Ann can do. You're going to see what God can do. I remember going to her home and seeing her red, swollen foot. I just knew that she would need IV antibiotics. She'd need that debrided. They cannot afford doctors, and they prefer not to have to go to doctors. They would prefer to rely on traditional medicine. 4 times a day I did hot and cold contrast baths with charcoal in it to her foot, and she got better. I graduated from Loma Linda in 1972. I interned at the Mayo Clinic in Rochester, Minnesota the next year, and did 1 year of a hematology oncology residency at McGill University in Montreal. Then I did the best thing that I did so far. I married my husband, Marnell, who was manager of his family-owned steel company in Dodge Center, Minnesota. After about 6 years in family practice, my husband noticed an article about the need for medical missionary doctors and nurses to work at the Kaohsiung refugee camp. We went overseas, which we thought was only going to be for a year, but it proved to be over a 5-year period of time, spanning several continents. We were thinking of moving down into an area 50 miles southeast of Rochester, and there was a recently developed Amish community in that area. So there were maybe about 100 families in the area. We were able to meet virtually every family in this community. They found out that there was somebody here that could help them with natural ways and that did not charge, and were happy to help and be available whenever they needed help. This was an Old Order Amish group that were very poor. These Old Order Amish do not care to have their pictures taken. That is to them a graven image. But some of them have been very gracious to us to allow them to take pictures of their barns or some of their houses or some of the things like that, which has been amazing. They are first and foremost farmers. The Amish can hitch up a horse, hoe in the garden, throw hay bales or anything in a dress just as well as anybody. Some certainly are craftsmen. And we're in Samuel Zook's shop right now. This is a beautiful little table that's made out of cherry wood. Baskets are very well done. It takes quite a bit to get that just right. I've given some of these to my grandchildren. So I was able at first to begin to work with the traditional Amish midwives. The Amish do home births primarily in our area, and my job was really mostly to work with them to provide a driver for them in case they needed to go to the hospital. In order to work very closely with the women, and especially in childbirth, I needed to dress and act appropriately within their cultural confines, which I do to this day. We try to make ourselves available to our community in every way we can. So our little home health retreat here where we're sitting became a place where we had a little room we used as our birthing room, so that if people didn't want a home birth, they could come to our place to do it. We have a horse hitch here that they can hitch their horses up when they come. We never lock our doors. And sometimes if they need something, they come in and leave a note on my counter. We need this or that, and if they need to go, just go leave a note, and then I go and see them. I am very grateful for 2 things. One, for my medical training that helped me to be able to diagnose and recognize conditions that I see. And 2, be able to treat a number of these serious conditions with very simple remedies that I have learned and that God has given me by experience. And I'm hoping that many further Loma Linda graduates will continue to catch that mission spirit that you're so confident that you can trust the great physician to tell you what to do. Because when you don't know, he will tell you what to do. Because I've had to have him tell me that many times.